turn to a tale of two doctors. Two Republicans, both doctors with two very different votes. Let's bring in two Republican medical doctors, Representative Andy Harris, who is also a member of the Freedom Caucus, and Representative Phil Rowe. Thank you both so much for joining us.
Good to be with you.
Representative Harris, I'm going to start with you, and I want this just to be a yes or no answer to start. At 2:45 p.m. Friday, you were undecided on the health care bill. Had it gone to the floor, how would you have voted?
I think I would have been with the president on this because we had assurances that they were going to do things in the Secretary of HHS was going to do things that were going to bring down premiums and had the power to do it. I think we were very close to a negotiated solution that would have that all parties would have agreed to.
Well, here's my issue with that. You do realize that the rest of your party was very intransigent. They did not want to move on this, and now, from many circles, the Freedom Caucus is getting blamed. And let me quote Chris Wallace to Jim Jordan, who is a member of the Freedom Caucus, Ohio. He said this weekend: "You guys won't take yes for an answer. You may have, Congressman, but the rest of your Freedom Caucus didn't. Why not meet halfway?"
Well, the problem was that negotiations were stopped 2 days before the Friday vote, and that's not the way you work in a legislature. You keep on going until you get consensus, and then you bring it to the floor. And unfortunately, the decision was made to make no further changes after Wednesday.
Okay, let me turn to Congressman Rowe. You were a yes vote, I believe, correct?
Correct.
Okay, you were going to be that yes vote, and let me just throw this out. Critics were saying that this bill did very little to shrink or certainly eliminate it got rid of the mandates and taxes, but it really looked like it wouldn't have lowered premiums or deductibles for many poor people. Why would you vote for that?
Liz, I think it would ultimately. Look, in our state, the fact that this bill didn't get voted on Friday doesn't change the fact that Obamacare in the state of Tennessee is an abysmal failure. And let me just give you a couple of reasons why we're going to have to do that and why I think those premiums will come down. Our rates went up 62% this year. A third of the counties in my district don't have an option. There is no option to buy anything. The third largest county in my state, Knox County, where Knoxville, Tennessee is, there are no insurance options on the exchange. I think given the fact that competition works, it works in every other industry, I think you would bring competition back in and give people choices, which is exactly what we want in a Republican health care bill. And I think that will bring premiums down.
Well, look, what's done is done, and the president says he's moving on. And as part of moving on, he says he wants to go to tax reform. But here's what Reagan economist Art Laffer said this morning about who he's now depending on as far as getting that through might be concerned. Listen.
I'm glad that Trump is reaching out to the conservative Democrats. I know them very well, and they have talked to me a number of times. A number of them have, and they want to be part of the tax process. And frankly, some of these Democrats are very, very good.
That's a Reagan economist, Representative Harris. Now it appears that he and Donald Trump are saying, look, I got to put your group to the side and try and work with the Democrats. How does that make you think and feel?
Well, first of all, I don't think the health care debate is over. I think this bill was put on pause. This bill can come back to the floor. It could come back to the floor tomorrow if a negotiated settlement was reached. And that's the best and clearest way to tax reform, is to get this out of the way, to bank those $1 trillion in tax cuts by eliminating the Obamacare taxes. That's the best and clearest way to do it. The president's done his job. We don't need the president. This is a House of Representatives issue now, and we should get back to roll up our sleeves. We took a deep breath over the weekend. I will tell you, I went home into the district. The only people who talked to me were people who said thank you for opposing it for a long time, because we made it better, and we're very close to an agreement. I think we should bring it back, do our job, and then move on to tax reform.
Is that a possibility, Representative Rowe?
I think it is, and I'm glad to hear Dr. Harris say that, because that was a different conversation that I had back in Tennessee. People wanted this bill passed for the most part, and I think, look, a negotiation's always better. I think certainly we are close, and I hope we do bring it back, because it needs to be passed. It's a promise we made to the American people. Andy and I both co-chair the Doctors Caucus, and a healthy debate's a good thing, but we need to pass this bill.
Okay. Well, Paul Ryan is also getting a lot of blame, not just the Freedom Caucus. Some frustrated Republicans are calling for his removal as Speaker of the House. Do either of you guys agree with that?
No, I mean, no. Look, this is an incredibly complicated bill, incredibly complicated process because of Senate rules. So, look, there is really no one that should be blamed. Let's just roll up our sleeves, get together, negotiate a settlement, bring it back, and then move on to tax reform.
Absolutely, Paul Ryan shouldn't be replaced. I mean, he has done a fantastic job. This was a difficult negotiation. Remember that the Democrats had 257. I was in the Congress my first year in 2009. They had 257 votes. It took them 15 months to get health care done. So I'm not ready to stop because it's a failure for my state. I want to go to work, get this bill replaced.
It's great. It's great to hear from you guys, but at the moment, Obamacare still lives. But replacing it, you two are saying, also still has a shot. Thank you very much. Congressman Andy Harris and Phil Rowe, both doctors.